Greetings to you, our beloved students, and welcome to this HIV management course. My name is Mr. Thomas Chone. I'll be the one to um, I'll be the one to take you in this particular today's lecture. So today's lecture is based on the course outline. So in this today's lecture, we're just going to make you go through the course contents or the table of contents of the things that we're going to cover in this particular course. Okay, let's get started. All right, so if you can see, this is a table of content covering several subjects and the subjects. All right, so these are the things that we're going to cover in this particular course. You can see that we are going to start with the module 1. Okay, so module 1 is HIV and AIDS information and management. So under this HIV and AIDS information and management, we are going to learn about the definition. Okay, so here under the definition, we are going to learn, or we are going to explain some key terms that are related to HIV and AIDS. Okay, these are what we call definitions. Okay, so we are also going to learn about the background. Okay, so here on the background, we're going to learn about the overview of HIV and AIDS. The overview of HIV and AIDS is going to be viewed globally and locally. So this is the background, what we're going to learn about. And then we're also going to learn about the Zambian situation. Okay, the Zambian situation, here we're going to learn about the HIV and AIDS status and the data in Zambia. Okay, the status of HIV and the data in Zambia. This is the Zambian situation. The things that we're going to learn here on number 3, the Zambian situation. And then we come to HIV natural history. So here on the HIV natural history, we are going to learn about the stages of HIV infection in the body. That's what HIV natural history is. We will learn about the stages of HIV infection in the body. Okay, and then we're also going to learn about the HIV transmission. So here on the HIV transmission, we're going to learn about how HIV spreads from person to person. This is what we're going to learn. And then we're going to learn about the signs and symptoms. Okay, the signs and symptoms suggestive of HIV infection. So here we're going to learn about the early and late symptoms of HIV. These are the things that we're going to learn about, the signs and symptoms. Signs and symptoms, we're going to learn about the early and late signs of HIV. Okay, and then we are going to continue with the continuum of care. Here on the continuum of care, we are going to learn about the steps in HIV treatment and support. Okay, so continuum of care, simply here we're going to learn about the steps in HIV treatment and support. Okay, and then we're going to learn about we're also going to learn about guiding principles. Okay, here on the guiding principles for the management of HIV and AIDS, we're going to learn about the important ideas for HIV and AIDS care. And then we'll further learn about coordinated approach. So here on the coordinated approach to chronic care, we are going to learn about the team-based care for HIV patients. Team-based care for HIV patients. Okay, and then finally, on module 1, we're going to learn about the summary. So here the summary, we're going to review some of the key points in the module. Okay, most of the points that are in the module, we'll review them in a summarized way. Okay, then we come to module 2. So module 2 is HIV testing and counseling. Okay, under this we're going to learn about the introduction. So here on the introduction, we are going to learn about the overview of HIV testing and counseling. And then on number 2, we are going to learn about the HIV testing during pregnancy. So here on the HIV testing during pregnancy, we are going to learn about the importance of testing expectant mothers. The importance of testing expectant mothers. This is what we're going to learn here on the HIV testing during pregnancy. Then we will further learn about HIV testing among youth. So here we'll learn about testing services for young people. Okay, we'll further learn discordance. Okay, we'll learn about the discordance among couples. Okay, on the discordance among couples, we'll learn about when one partner is HIV plus and other is not. Okay, this is what the discordance among couples. Here we'll learn if one partner is HIV positive and the other one is not. These are some of the things that we'll also learn here. Then we'll further learn about the goals and benefits of counseling. So here on the goals and the benefits of counseling, these are some of the reasons as to why counseling is important. Okay, we'll also learn about the basic principles of counseling. So here we will learn about the core rules for counseling practice. Okay, we are also going to learn about the principles of HIV testing and counseling. So here on the principles of HIV testing and counseling, we'll learn about the ethical and practical guidelines. Okay, and we're also going to learn about the approaches to HIV testing and counseling. So approaches, these are the different ways of offering services, as well as testing as entry to HIV care. So testing, okay, all right, so testing as entry to HIV care. So testing, okay, so we are also going to learn about the HIV testing and its benefit. So here on the HIV testing and its benefit, we'll learn about the advantages of knowing HIV status. Okay, and then we're also going to learn about conducting the HIV test. So on the conducting the HIV test, we are going to learn about the steps in performing HIV tests. Then we'll also learn about interpreting results. So this is where we are going to be understanding HIV test outcomes. Okay, and confidentiality. So on the confidentiality, we are going to learn about respecting the patient privacy. You test a patient and then you should know how to maintain the privacy of the patient, even in any procedure. We're also going to learn about the counseling skills. So on the counseling skills here, we are going to learn about communication skills for counselors, the way you're supposed to communicate with your clients. And we're also going to learn about the qualities of a counselor. So qualities of a counselor are some of the traits of a good counselor. Okay, and then further we learn about the conditions, core conditions of relationships. So the core conditions of relationships are what we call building trust in counseling. So we're also going to learn about counselor self-care and well-being. So this is where we are going to learn about the caring for the counselor's health. And then finally, we'll do a summary, which is the recap of the counseling module of module 2. Okay, we continue. So here we are going to learn about the goals of therapy. Okay, on module 3. So module 3 is combined antiretroviral therapy, which is the ART. Okay, so the combined antiretroviral. Okay, so let's start with let's do the goal and general principle of combined antiretroviral therapy. So here we'll learn about the goals of therapy in module 3. And then we'll further learn about the general principles of ART, okay, which are the arts. And then we'll learn about the prerequisites for administration of art. And then we'll further learn in module 4 HIV prevention. So under HIV prevention on module 4 in section 1, we'll learn about the education for positive, healthy, dignity and prevention, which is abbreviated as the PHDP. And then section 2, we are going to learn about the primary prevention of HIV and prevention of unintended pregnancies in HIV positive women. Okay, then we're going to continue with the section 2, which is the primary prevention of HIV and prevention of unintended pregnancies in HIV positive women. Then we continue with module 5, which is the antiretroviral drug information. So the antiretroviral drug information, here we're going to learn about some few. Okay, so we are going to further learn about okay, we have some bit of network challenges. Okay, so we're going to learn about the antiretroviral drug information. So under the antiretroviral drug information, we're going to learn about the overview of immune cells and protein synthesis. And then we're going to learn about this description of antiretroviral drugs. We'll further learn about the side effects of toxicity and managing side effects and toxicity. Then we're going to learn about the life-threatening toxicity associated with ART. And then we'll continue with drug interactions. Okay, and then in module 6, we are going to our module topic of 6 is specific interventions to prevent mother-to-child transmission of HIV. And here we're going to learn about the role of maternal, neonatal, and child health services in the prevention of HIV infection in infants and young children. Then we will further learn about the overview of the comprehensive antenatal care package. Okay, then we'll continue by learning the antiretroviral therapy in pregnant women. And on module 7, we're going to learn about the maternal, infant, and young child nutrition in PMTCT. Okay, and then we'll learn about the national guidelines for infant and young child feeding and other key components that promote optimal infant feeding in the context of HIV. Okay, and then module 8, we'll learn about patient assessment. So how do we assess a patient? We assess a patient with a patient history, which is number 1. Then the important laboratory tests, the tests that were done by the counselor, and then the HIV disease evaluation and monitoring tests. Then module 9, we're going to learn about managing HIV infected populations, WHO clinical staging. We're also going to learn about the WHO clinical staging and one is line art, which are CART regimen to initiate. And then we'll learn about the practical hints for EFV or NVP. We will further learn the practical hints for starting pregnant and breastfeeding women and their sexual partners on lifelong as CART. And then module 10 is on adherence. And under adherence, we're going to then assessing adherence. We continue. So we're also going to learn about the stages to improve adherence. Okay, then module 11, we're going to learn about monitoring patients on combination ART. So under this, we are going to learn about monitoring and follow-up. So monitoring and follow-up is checking the patient progress on the ART. So remember, the ART are the drugs. So under monitoring and follow-up is whereby we check a patient and their progress on the ART. And then assessing effectiveness. So here, when assessing effectiveness, is the treatment working? So that's what it means. Is it the treatment working that the grant is being given? And then managing ART toxicity. So managing ART toxicity is whereby you are able to know that the side effects, the handling side effects. Okay, that's what it is. By managing ART toxicity is handling side effects. Okay, and then we are also going to learn about adverse effects and toxicity. So adverse effects and toxicity are identifying harmful reactions, okay, and then changing ART due to toxicity. So changing due to toxicity, or we may say changing ART due to toxicity is switching drugs if needed, some of the drugs that are needed. And then immune reconstitution syndrome. So immune reconstitution syndrome is a reaction as the immune system recovers. Okay, that's what it is. We come to changing drug regimens. Okay, so changing drug regimens refers to adjusting the medication plan. That's what it is. And then treatment failure. So treatment failure, okay, let me just move it very well. Okay, so changing ART due to treatment failure. So changing ART due to treatment failure is adjusting, is what to do when ART stops working. What do you do when the drug stops working? That's where that's what we'll learn also here. And then we'll learn about resistance, hypersusceptibility, and the replication capacity. So replication capacity, here we are going to learn about dealing with drug resistant HIV. Okay, and then we come to selecting new regimen. So selecting new regimen is choosing alternative ART options. And then we also have some practical hints for the practical hints to aid in choosing a specific second line regimen. Okay, this is the tip for switching ART safely. Some of the things that you also learn. And then stopping ARV therapy. So stopping ARV therapy is when and how to stop the ART. Okay, and then we come to referring patients. So referring patients is a situation whereby you are sending patients for specialized care. You are referring them to other specialized care due to certain condition that you can't manage by yourself. Okay, and then finally we come to module 12. So module 12 is the infection prevention at the workplace. Okay, so infection prevention at the workplace, we will start with the basic concepts. So here one will be understanding infection prevention. And then number 2, under hygiene, we'll learn about the importance of clean hands. And then personal protective equipment, PPE, is actually the use of gloves, gowns, etc. Then safe handling of needles. Here we'll learn about avoiding needle injuries. And then processing instruments and gloves. So here we'll learn about cleaning medical tools safely. And then further we'll learn disposal of waste, okay, which we call safe disposal of infectious waste materials. So here we'll learn about the safe management of infectious waste. Then we'll learn about the post-exposure prophylaxis, which is PEP. Here we'll learn about the medicine after exposure to HIV. So beloved students, this is our end for today, and these are some of the things that you will learn in this particular course. Thank you very much.